An estimated 39.5 million people, including 10.5 million children in the United States, had been diagnosed with asthma in their lifetimes. Of the 39.5 million, 18.9 million adults and 7.1 million children still have asthma. The estimated total cost of asthma to society, including medical expenses, loss of productivity resulting from missed school or work days, and premature death, was $56 billion in 2007. In 2008, children aged 5 to 17 years who had one or more asthma attacks in the previous 12 months missed 10.5 million days of school. In 2010, asthma accounted for 3,404 deaths, 439,400 hospitalizations, 1.8 million emergency department visits, and 14.2 million physician office visits.
What is asthma? During breathing, the air that enters the nose and mouth enters the respiratory passages. Then the air entering the respiratory system passes through the trachea, then splits into the bronchi, bronchioles, and finally enters tiny sacs called alveoli, where the exchanges of gases takes place. Asthma is a disorder of obstruction to breathing due to inflammation and narrowing of the bronchial tubes. Initially, the bronchial tubes become and produce thick mucus. Later, the muscles surrounding the airway tighten up and the air cannot move freely. This is called bronchospasm. The result is shortness of breath, and the air moving the airway causes a whistling sound known as wheezing. Pollen, pet dander, weather changes, tobacco, smoke, etc. can trigger and worsen asthma symptoms in susceptible patients.
One tip is to use bedding encasements to prevent dust from accumulating on your mattress. Wash bed linens weekly. Avoid down fillings. Limit stuffed animals to those that can be washed.
Reduce humidity level. People allergic to pet dander should not have them at home. Most importantly, exposure to environmental tobacco smoke should be reduced, if not eliminated at all. Evidence shows an association between environmental tobacco smoke exposure and asthma development among preschool-aged children.
Management of asthma. Clinical management includes oxygen therapy protocol, bronchial hygiene therapy protocol, aerosolized medication protocol, and mechanical ventilation protocol. Medications commonly prescribed includes xanthines, corticosteroids, anti-inflammatory agents, and leukotriene inhibitors.
Most importantly, achieving and maintaining control of asthma symptoms by normal activity levels, including exercise, are vital in its management. Pulmonary function should also be maintained as close to normal levels as possible. Another goal is to avoid adverse effects from asthma medications and ultimately to prevent asthma mortality across all populations.
National Asthma Control Initiative. By working with strategic partners, demonstration projects, and clinical champions, the NACI has shown how to put asthma guidelines into action at home, school, work, healthcare settings, and the community. Health education campaigns are one aspect of larger programs of professional, patient, and public education designed to reduce the risk and consequences of heart, lung, and blood disease. NHLBI campaigns focus on raising awareness and disseminating key messages to increase healthy behaviors.
May 6 was the Make a World of Difference on World Asthma Day. Part of this initiative is to get asthma-aware Thunderclap. Thunderclap is an online action site where you can share the same message through your favorite social media channels in a single stroke to increase asthma awareness.
Another important initiative is the Global Initiatives for Asthma, or GINA. They form the basis for local and national initiatives to improve services for asthma patients. Its major goal is to disseminate proven methodologies for implementing asthma guidelines. This initiative also assists with the translation of asthma guideline recommendations into quality programs using current knowledge translation principles and evidence-based practice.
Other initiatives include social networking for a systematic application of marketing to achieve specific behavioral goals for social good. Messages must be few, simple, clear, practical, and tailored to the group. For example, a child that coughs at night in the absence of a cold may have asthma.
New methods of guideline dissemination in support of implementation plans may also include new communication tools to offer innovative ways of communicating guideline recommendations. Embedding guidelines into electronic health records is a novel way of improving access to treatment recommendations at the site of care. However, further research is required to determine the effectiveness of these methods.